Hello guys, my name is Zulkarnain Haider. We are back again with the series of general anatomy talking about the anatomical nomenclature, and we studied the related topics to it. Now we will see something about flexion and extension. In the previous video, we talked about the flexion and extension of head, arm, wrist, joint, the hand at the wrist joint, and we talked about the arm, that flexion of arm is forward, upward, and medially, and the extension is backward, upward, and laterally. Now we will see about the flexion and extension of the foot. If we see about the flexion and extension of the foot, the extension of the foot is at the ankle joint, which is called dorsiflexion. The opposite movement produced by flexors of the foot, the flexors of the foot are located at the posterior compartment of the leg, which are also known as the gastrocnemius muscles and other muscles, increasing the angle between the leg and the foot so that the foot moves in the downward direction. Therefore, this movement of foot is called plantar flexion. We call it plantar because there is sole. So as we studied previously, the palmar side and the plantar side. The palmar side is of the hand and the plantar is of the foot. You must understand that the plantar flexion is the real flexion of the foot, while dorsiflexion is actually the extension of the foot at the ankle joint. Now, if we talk about the flexion and extension of the trunk, these movements occur as a result of bending of vertebral column at the intervertebral joints. The intervertebral joints of the lower thoracic and lumbar regions, lower thoracic and lumbar region. I hope you know how many vertebrae are there in thoracic and lumbar region. So as it happens when a person bends to pick an object from the ground, there is flexion of the trunk, and extension of the trunk moves it backwards in the dorsal position or the dorsal side. However, it is noted that extension of the trunk is much more limited than its flexion. The flexion is more and the extension is less. Now we talk about two more terms, abduction and adduction, used for movements of limbs as a whole or for the movement of the digits of hands and feet. Abduction carries the limb away from the median plane. Adduction brings towards the median plane. Adduction is actually to add to the body. If we take our limb away from the body or away from the median plane, then it is known as abduction. And if we bring it back towards the median plane or towards the body, it is known as adduction, that we added something to the body. In upper limb at the shoulder joint, so abduction or adduction in upper limb is at the shoulder joint, and in lower limb it is at the hip joint. Different lines of reference have been devised for the abduction and adduction of fingers or hands, fingers of hand and toes. As far as it is regarded with the median plane, if we see the organs, they also have a separate median plane or a median line. For example, if we see the median line of a hand, it crosses the middle finger of the hand to the palm. And if we see the median line in the foot, it crosses from the second toe, which we can say as the second finger. So the median line of hand is this. For example, if you move your fingers away from the median line of the hand, it is known as abduction of the fingers or the digits. And if you bring it back towards the normal position, it is known as adduction, because you have added it to the median plane or added to the body. If you see about the median line of the foot, it is at the second toe. And if you move the fingers or the digits away from the medial line and open them, this is known as abduction of the digits of the foot. And if you bring them back towards the median line or the median plane of the foot, then it is known as adduction of the foot. This was all about the abduction and adduction, and further in the next lecture we will see some special movement of thumb. And if you like this video, then make a like, subscribe and share it. And if you have any further questions, you can ask in the comments. Thank you.